Hi, Mike Gibson, Lee Perreault here, and we're talking about preventing diabetes and pre-obesity, and then can we reverse some of these disorders like obesity or diabetes, sorry. So Lee, I think it's looking pretty clear like we can forestall the development of diabetes, perhaps with weight loss and some of these newer agents. I noted something very interesting in the FDA's guidance. They said it's not enough just to show that you turn down some of the biochemical markers of diabetes. They want a little more than that in terms of saying we prevented or halted progression to diabetes. That's question number one. Are we there? Are we going to get there? The more important question, can we reverse the curse? I mean, if you lose your 25% body weight, keep it off. Can you reverse that type 2 diabetes? So what are your thoughts?
Yeah, again, like really, really, really good questions as always, Mike. And I would say, yeah, I think we're thinking more and more along those lines. I mean, I kind of think about obesity as sort of like the trunk of a tree, and all these branches come off of that trunk. Things like diabetes, fatty liver disease, sleep apnea, osteoarthritis. I mean, you kind of name it, heart disease, et cetera. And historically, as medical providers, we run around and we try to take care of one branch at a time rather than tackling the whole root cause of what's going on. But I think there's really a change in thinking that's happening right now that's really, really exciting. So, for example, a couple of years ago, the American Diabetes Association, they reissued guidelines and they made weight management a primary goal for people with type 2 diabetes, not just controlling blood sugar, but controlling the body weight because the body weight contributes so much to the blood sugars. And this was really, I think, a major leap for them because it was finally getting to the root cause. And just very recently, you may have heard that tirzepatide got an indication for obstructive sleep apnea. So again, it's getting to that root cause of the weight gain that leads to the sleep apnea, and then really trying to not just treat the sleep apnea, but reverse it, get rid of it, cure it, if you will. And so I think we have tools now that we never really dreamed of that could absolutely, treat diseases, reverse diseases, prevent diseases, and what I think a lot of us are calling kind of disease modifying.
Yeah. Well, that's going to be exciting. I mean, if I think we're very close. I mean, some of the studies look very clear that like your progression, at least to biochemical type 2 diabetes is reduced. So I think with longer follow-up, we'll be able to show that. But I think it's going to be a real game changer if we could reverse the curse and really get someone, to help their pancreas get back to health. That would be a game changer.
Yeah, absolutely. I mean, nobody wants to have all these diseases. I think, and when you do reverse them, it's like it's pure magic. It's transformative to see somebody go through that and they literally become younger before your eyes. It's incredible to kind of watch it. It's just something that we never imagined we could do, and yet now we are absolutely doing it.
Well, I know on the cardiovascular side, on
Mhm.
the coronary artery side of things, these kinds of treatments, they reduce the amount of fatty plaque in your
Mhm.
arteries. Duh. I mean, you're reducing fat. It doesn't really change some of the calcified stuff. So you're not going to really reverse calcified heart disease, but you are going to reverse the fatty stuff that puts you at risk of a heart attack. So I think for that organ, we can see partial reversibility of disease and certainly a reduction in risk. So it'll be fascinating to see what we do in the liver and brain and
Mhm.
pancreas and everywhere else. Well, Lee, thanks as always for joining us. Great having you on today.
Thank you.